Okay, so I've already previously done her vital signs and height and weight, and they're all within normal limits. I would wash my hands, I would introduce myself to the patient, I would provide for privacy by shutting the door and closing the curtains. I would identify the patient by asking her name and date of birth.
Mary Forte, 4795.
Then I would ask her if she has any allergies.
Strawberries.
Then I would explain the procedure to the patient. Have you ever had a head-to-toe assessment done before?
No.
Okay, so I'm going to use 4 techniques, and it's going to take around like 20-ish minutes. And I'm just going to start by inspecting your skin, just looking at it, and then I would palpate by using my hands and just feeling around, and it's a little awkward. And then I would percuss using my fingers and just listen to your normal body sounds, and then I would auscultate using my stethoscope and also listening to your normal body sounds.
Okay.
And then I would ask the patient her name,
Mary,
where you're at,
UACCB.
what time it is,
Around 4.
and why you're here.
Head to toe.
So patient is alert and oriented ×4. As her posture is erect for her age, she's sitting comfortably in the chair with her arms relaxed on her thighs and her feet are on the floor. As she walked in, I noticed her gait and balance was even, no irregular movements, her stance was fine. Her facial expression, she's smiling at me, she's cooperative. Her mood appears to be pleasant, she's responding to me. Her clothes appear to be fine for the weather. She's appropriate, clean, neat and clean. Her skin appears to be pale, but she's told me this is her regular skin color. She's warm, she's dry. Her skin is smooth with no thickening over the palms of her hands or soles of her feet. I see no bruising or vascularity issues present. I see no lesions or scars, no edema present. Her turgor and mobility is intact. She does have 5 tattoos present, 2 on her shoulders, 2 on her forearms, and 1 on her abdomen, but they all appear to be healed. So now I am going to assess your cranial nerves. I'm going to start by asking you to close this nostril and breathe in, and then do that to the other side. So her nose is patent. And then I'm going to ask you to close your eyes, occlude one nostril, and then tell me what you smell.
Hot cocoa mix.
And then proceed to do that to the other nostril.
Alcohol wipe.
So cranial nerve number 1, olfactory, is intact. Cranial nerve number 2, optic, we've already previously done, and it was the Snellen eye chart, and she was 20/20 -0 in both left and right eye bilaterally. So cranial nerve number 2, optic, is intact. Cranial nerve number 3, I'm going to assess. Her pupils are equal, round, reactive to light. They constrict from a 4 to a 2. Then I'm going to assess cranial nerve number 3 in another way. So cranial nerve number 3, oculomotor, is intact. Cranial nerve number 4, we just did with the cardinal fields of gaze. So cranial nerve number 4, trochlear, is intact. Cranial nerve number 5, trigeminal, I'm going to assess by asking her to close her eyes and tell me when she feels this on her face and scalp.
No. 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 No.
And then I'm going to assess it by turning her around and then asking her to open and close her mouth. Again. So cranial nerve number 5, trigeminal, is intact. Cranial nerve number 6, abducens, we've already previously done with the cardinal fields of gaze, and that is intact as well. Cranial nerve number 7, facial, I'm going to assess by asking her to close her eyes, and then smile for me, and then frown. And then I'm going to ask you to open your mouth. She has adequate saliva. So cranial nerve number 7, facial, is intact. Cranial nerve number 8, I'm going to push in and out in your tragus, and then I'm going to whisper a word to you, and then I'm going to ask you to repeat me.
Okay. Basketball. Baseball.
So cranial nerve number 8, vestibulocochlear, is intact. cranial nerve number 9, glossopharyngeal. We've already previously done the gag reflex, and that was positive and intact. And then I'm going to assess glossopharyngeal by asking her to take a drink of this. And her swallowing was intact. So so cranial nerve number 9, glossopharyngeal, and cranial nerve number 10, vagus, is intact. Cranial nerve number 11, accessory, I'm going to ask you to shrug against my hands again. So cranial nerve number 11, accessory, is intact. Cranial nerve number 12, hypoglossal, I'm going to ask you to stick your tongue out. I see no irregular movements or fasciolations. So cranial nerve number 12, hypoglossal, is intact. So all the cranial nerves are intact. Now I'm just going to look at your head. Your head appears to be normal cephalic with proper alignment. Is this your normal hair color?
Yes.
So her hair appears to be brown. Her hair appears to be fine with even distribution. I'm going to turn you around. I see no lesions, nits, scaling, or discolorations, or inhabitants. And then I'm going to ask you if you feel any tenderness when I palpate your scalp.
No.
No tender. So no tenderness is noted. I feel no nodules or masses or thickening. Her facial features are all symmetrical in proper alignment. I'm going to do her eyes now. Her eyes, I see no drooping, discoloration, or masses. Her eyelashes appear to be even in distribution. I'm going to palpate her lacrimal ducts. Tell me if you feel any tenderness.
Nope.
No tenderness is noted. I see no drainage on the lacrimal ducts. It's not inflamed, no swelling or lesions. I'm going to palpate your frontal and maxillary sinuses now. Do you feel any tenderness?
No.
So no tenderness noted on the frontal and maxillary sinuses. As I'm looking at her eyes, her sclera is white. I see no drainage. Can you pull your... Her conjunctiva is pink. I see it's clear discharge, no swelling or lesions noted, no inflammation. Her pupils are flat, not flat. Her irises are flat, round, and with even coloration. I'm going to ask you to look at the wall behind me. And then look at this. And follow. Her pupils accommodate and constrict. I'm going to look at your eyes real quick. Her pupils constrict to direct accommodation, and then the concentral, the other pupil constricts. Her pupils rest at a 4, and they both constrict to a 2 bilaterally. Then I'm going to do your nose, and it appears to be symmetrical and midline and proportional to your body. I see no lesions or nodules on the outside. Can you lean up for me? She has a slight septal deviation. I see no lesions, drainage, or exudate inside her nose. And then I'm going to do your mouth. Her lips are pink, smooth, moist. I see no cracking. I'm going to put on gloves real quick. Ignore that. Okay, so I'm going to have you open your mouth for me. Her gums appear to be pink, smooth, moist, and I see no lesions or nodules inside or inflammation. Her mucosa is pink, smooth, and moist, no lesions or nodules present. Her teeth are straight. I see they're white. I see no fillings. I see no carriers or malocclusions. Her tongue is pink, It's smooth, moist. I see no nodules present. I'm going to look at her tonsils. She has no tonsils present. Can you say all for me? Her uvula rises to the midline. As I'm looking at her pharynx, it's smooth and it's pink. I see no lesions or inflammation present. Can you look up for me? Her hard palate is whitish with transverse rugae, and her soft palate is pink and smooth. It's moist. I see no lesions present. Sorry if that tastes nasty. I'm going to feel of your tongue. Okay, can you stick your tongue out for me? I'm palpating no nodules. Sorry if that's okay. Then I'm going to do your ears. Okay. So they're proportional in alignment. As I'm looking at both the auricle and tragus, I see no lesions or nodules present on the outside, no discoloration. I'm going to palpate and tell me if you feel any tenderness.
No.
No tenderness is noted on the auricle, tragus, bilaterally. I'm going to look inside your ear now. No lesions or drainage present, no nodules. No lesions or drainage present either on either sides. Okay, as I'm looking at her neck, it is symmetrical, her muscles are intact. I'm going to tell me if you feel any tenderness.
No.
So no tenderness is noted. I'm going to ask you to lean forward, lean back, side to side, and then all the way around. So she has full range of motion without limitations. I'm going to palpate your carotid arteries. Carotid arteries are 2+ bilaterally. Now I'm just going to listen to see if I hear any bruise. And each time I listen, I'm going to listen in 3 spots. And then I'm going to ask you to breathe in and hold it. And then I'm going to try to get it done as fast as possible so you don't pass out.
Okay.
And then I'm going to do it using my bell. Okay. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Okay, 3 more times. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. So no bruise were present. Now I'm going to palpate your lymph nodes. Preauricular, posterior auricular, occipital, submental, submandibular, tonsillar, superficial cervical, deep cervical chain, supraclavicular, and then posterior cervical, and they were non-palpable. I'm done.
Yay!